This would be him on an uneven surface. This would be the next stage 2 of intensity. Then stage 3 of intensity would be just one-legged on a firm ground. Again, going through these different motions, these different exercises with the ropes. And then the final intensity stage, this would be pretty much when they are ready to return back to play. This is really working on balance as you're doing this as well. It would be one-legged on an uneven surface. This is really working on his balance and core along with his arm muscles and other strength gains.
We're going to do a normal push-up, and then you're going to bring one up, your right arm up, and go to the right, bring the other one up and move, and you're going to do a normal push-up, and we're focusing on bringing your arm all the way up. And you want to keep your hips almost level when you're bringing it up, using all your scapular motion. And then we're going all the way around the clock, so you're doing the same motion, focusing on the same things, and go all the way around once.
Alright, the next exercise we're doing is just lat pull downs. What we want to focus on is when the patient brings it down, he wants to go behind the head. You want to add enough weight to where he has some good resistance, but you don't want to add too much where he's going to get very fatigued. We're going to do 3 sets of 10 like this. What you want to focus on is making sure that they go all the way down, at least as far down as they can. And when they do this, you want to try to make sure that they are pinching the scapular muscles together. You want to get that good pinch in the scapular rhythm. A good retraction. Alright, for the next exercise we're going to do an ab roller, and this is really going to work on core along with shoulder stability. What we're going to have the patient do is just 3 sets of 10, and we want to do at 3 different angles. We want to do 1 straight out, and we want to do 1 to the left and 1 to the right. What we want to focus on is making sure that they go down as far as they can, and they're still able to pull back up into the normal position. But you just don't want to see too much overcompensating on one side or the other. You want to try to stay as even as you can during all angles of the exercise. So the first one is, again, straight out and then back, and then the next one is to the left and then back, and then the final one is to the right and back. And again, you want to do 3 sets of 10 at each angle, so that'd be 30 altogether. Alrighty, another one of our advanced exercises are going to be shoulder press, and we would like to do this with a free weight because it will really help with the shoulder stabilization as they go up and down. What you want to focus on is, as they're doing this, they want to be straight up, and then they want to come right back down. You want to get to about 90 degrees. You don't want to go too much lower than 90 degrees. You should go right to about there, and then back up. And you really want to make sure that they stay symmetrical. You don't want one arm going above the next one. You want to make sure they go pretty much at the same speed, slow and controlled up, slow and controlled down. We're going to do 3 sets of 10, and you just want to make sure that you're here to help them if they do start to get wobbly. You're right here, and if they do get fatigued like that, you want to drop the weight. You want, well, not just drop the weight, but you want to lower the weight in the exercise.
Alright, for this exercise, we're going to start standing, and then the patient's going to get on their hands. They're going to walk out into a push-up position, and when you're walking out, you want to keep your arms straight. That way you keep the pressure on your shoulders, and then you want to get level, and then start walking your legs back towards your feet, and you're going to keep doing that.
Alright, our next exercise is going to be a third bar on the wall, ABCs. And what we're going to be doing in this one is you want to try to keep the ball when it's at rest, close to your head, shoulder height, and then we're just going to go through ABCs. And when you're doing the ABCs, you really want to try to be very big when you're drawing your letters. So really emphasize A is all the way up, all the way down, in the middle. B, really try to get that good circular motion. Same thing with C's and D's. You want to overemphasize all the motions of this. This is really working on all your ranges of motion in your shoulder blade. Every now and then the ball may be slipping downwards. Go ahead, just fix it. You still want to keep it at the head and neck level as you're going through this. You don't want the patient to be overcompensating by moving their body really at all. You want to try to make sure that their trunk is stationary and the only thing moving is the shoulder. You don't want them kind of moving their hips as they're moving the ball around. You just want to isolate the shoulder movement. Exercises are going to be rows, and what we're going to be doing here is we're going to add weight, and they're just going to be going straight back with their elbows like that. And again, you want to have a slow movement. You want it to be controlled. You don't want them to just jerk back really quick. You want it to be slow both ways. We're really looking on, again, the scapular retraction. We're going to try to make sure that their chest stays relatively stationary. You don't want them to be using their hips and their trunk to help force the weights back. We're going to make sure that they're using their shoulders when they're doing this. So you want to make sure that they're not leaning back like that. You want to make sure that they are just using their shoulders in this exercise. Alright, our next exercise is going to be reverse fly. What we're going to be doing, we're going to use the machine to do this. You're going to add some weight. This is going to help for strengthening. You're just going to come all the way back as far as you can, and then return back to normal. Again, you want it to be nice and controlled. Duck the whole range of motion. You don't want them to just be trying to rep it out as fast as they can. We really want to focus on the scapular retraction here. Make sure that they're getting that good pinching in here. We want to do 3 sets of 10 like this. And you want to make sure that they're not overcompensating by, again, moving their chest off of the machine. You want to make sure that it's pretty much just scapular. The next exercise we're going to do is the pinwheel exercise, and what you want to do is grab some weights, some dumbbells. You really want them to be pretty light, because what we want to do is we want to have them out at pretty close to shoulder height, and then you're just going to be going up and down. You're going to do 10 each way. So once you get 10 forward, you're going to stop and reverse and do 10 this way. Again, you want to make sure that your shoulders are pretty much shoulder height the whole time, and you're really just kind of going through the motion. You don't want to compensate. You want to make sure they're not compensating by just going down here. You want to make sure that they get the full rotation, that they're not just kind of going through just a little bit and holding up there. You really want to make sure that they are getting a lot of movement in with the shoulder.